Hello, and welcome to episode two, titled Reframing CRPS. This episode, I went through and talked about how pain and CRPS kind of steals our identity from us. It makes us forget who we are outside of CRPS. It's my belief that a big part of recovery and healing from CRPS is remembering who we are without the pain. What makes us unique? Is it our love for baking or our dogs or entertaining on our back porch? Is it our creativity, the way we help others? What kind of things make us us without CRPS? I want to encourage all of you as you watch this episode where I talk to fellow warriors with CRPS. Um, Consider for yourself what makes you you. And how can you approach doing those things that make you you again? Because if there's more of us, then maybe there's less pain. On top of that, I also want to say that I'm really thankful for all the people that have been supportive of me doing this. When I had CRPS, I promised myself that I would reach out to people who had it and try to help them if I ever figured out a way to reduce or get out of pain. So now being in the blessed position that I am to be working with people with CRPS at my hospital and also helping people here on the support groups and on YouTube, I'm just really thankful for it. And I'm happy to be here to give you guys information. That being said, with the sheer volume of people that have messaged me and emailed me and called me, I want to let you guys know that I'm going to start a mailing list so that every week, even when I'm not hosting the Zooms, I can send out informational forms, about things I talk about in the Zooms or activities that you could do to help move more towards you and away from CRPS. So if that's something you're interested in, you can go to my website. It is the window pane, PAIN. Once again, the window pane, PAIN.com. And right at the front page of my website, there will be a click here button where you can sign up for my mailing list. On that mailing list, you'll get an email welcoming you to the mailing list, and then make sure to click the button there, and you can get the first free educational form that talks about the alarm, which is something I discussed in the first episode. So yeah, if that's something you're interested in, please go ahead and sign up. And then in February, I plan to launch something more comprehensive. That's an 8-week program for people to, I guess, take a lot of the knowledge that I've acquired in 10 years and use it in kind of a classroom format, I guess, kind of the way I've been doing these Zooms, but something much more structured and organized. I'm really, truly blown away by the response since I just started posting this November 1st for CRPS Awareness Month. So yeah, I'm hoping I can bring something to you guys that is everyone can access and use to help forge their path to less pain and maybe remission/recovery. So yeah, thanks so much, and I hope you enjoy this episode. And my messages are always open, so if you have questions, let me know, comment them, or reach out and join us for the next Zoom. Last thing, the next Zoom is going to be Saturday, December 21st, so 12/21 at 2 p.m. Central Time. And I'm not going to post it in the description this time because we kind of got hacked at the beginning last time. So you'll have to find it on one of the Facebook groups and we'll go from there. So yeah, Saturday, December 21st at 2 p.m. US Central Time will be the next free Zoom conference. All right, guys, enjoy this one. Bye. Okay, we're recording. If you don't want your face on here or your name, you can turn your stuff off or change your name. That's fine. But so what I want to say, what I was mentioning is sometimes the key to missing the big picture is looking at everything close up. And when it comes to CRPS, some of us have it affected in a hand, some of us in a foot, some of us our whole body. Pain is everywhere. We don't know where it stops and where we begin. But I want you to know that none of you are a left foot or a right hand or a groin area or any of those things to me. Each and every one of you is an individual human being. And I think that's what's missed in medicine is there's a complexity to pain that has more to do than just a limb or nerves or muscles. Pain is a part of you, and you are the thing that we as medical providers should be looking at. And so that's what I'm trying to bring, I think, in a big way to the treatment and care for CRPS, is because pain makes us lose ourselves, and lose ourselves in ways we never imagined. Okay, and I want to. So today, the kind of the theme is about bringing us back. And so for that, I want to do a little demonstration that I've actually borrowed from someone named Tamar Pincus, and she's a good psychologist you guys can look up anytime when it comes to pain. But I'm going to show you guys that. So give me 1 second. I'm going to put her name in the chat so you have it for later. Okay, let me let Gwen back in. Okay. So hopefully I'm going to change the view. I don't know what view you guys have, but I'm going to have it on speaker view. And I'm going to, let's see. Yeah, I'm going back to gallery view because it wasn't working properly for me. Okay, so that being said, here's a little explanation of pain. Okay, so this is me or you, and what this is everything that I am in one bright piece. Okay, and the things that make up me or you are: I'm a brother, I'm a son, I'm a physical therapist, I enjoy exercise, reading, knowledge, coffee shops on certain days. That's all me right here. And this is pain. There it is. And when I get pain, of course, I say, I don't like that. I don't want it here. And I go to a doctor and I say, sir or ma'am, could you please take the pain away? And they say, certainly. Oh, a little bit there still. And they take it away. And now this is me. But what has happened, and has happened to so many of us, is that's not the end, right? And the pain comes back. And it's in a certain spot. And then our beliefs about the pain, they come back. And more pain comes. And at that point, life is happening. And now, when we go to the doctor, we say, sir or ma'am, can you take it away? And the doctor looks at us, and some of them not even knowing what CRPS actually is, they say, no, I can't. Because now it's truly part of us, right? And as we deal with our pain and our experiences and watching others go on about their lives, it becomes a situation where it's so tangled for us that we aren't even sure where the pain stops and where we begin anymore.
You bet.
And so now this is us. We're not as bright as we used to be. We don't do the things we enjoy. And most of what we are is pain or CRPS. So in this situation, what can we do? Because the doctors can't help us get rid of our pain. No one really has answers. And for a lot of us, we've spent years just trying to survive, right? And so the only logical answer is to start to find more of ourself again. Okay, so what kind of things make us us? For me, when I was going through it, it was exercise. And so I went to the gym with my walker and attempted to lift with my hands instead of my feet. For some people, it's art. So you sit down in a wheelchair and you start painting for even a minute a day if you can. For other people, it's their pets. I've seen a lot of people with pictures of their dogs on their profiles, etc. And for more of us, it's our family. And little by little, we start to reclaim what makes us us. And in the end, now this is me. Not as bright as I used to be, and the pain is still there, but look at me now. I am brighter and I am bigger. So the point of me saying all of that is sometimes we get lost in CRPS or AMPS or whatever pain condition we're dealing with. And by lost, I mean literally lost to the point where we wake up and don't recognize ourselves.
Yep.
What I would like you guys to do this week and in the 2 weeks that I'm going to be gone is try to think about what is it that makes you you? How can you make yourself brighter in some way? That doesn't necessarily involve thinking about the pain, and you may still be in pain when you attempt it, but at least it's something different. At least it's a step, right? Okay, so people are still trying to trickle in, and I'm gonna share my screen to a PowerPoint, much like last time. And if you have questions, please put them in the chat, and I'll have them for you, or I'll answer them for you as we go. Okay, can we see my screen?
Yep.
Yes.
Okay, here we go. Okay, so for those of you who are in here that don't know who I am, my name's Chase Teagarden. I am a doctor of physical therapy and a therapeutic pain specialist, as well as a fellow of pain science. That means I've had a 3-year doctorate, which was preceded by 4 years of an undergrad, 2 years of a master's. And then I also had 6 months training as a TPS and 2 years training as a fellow of pain science. Okay. And then losing myself. So this is the same story as before, as I said last week. You guys that have watched the previous Zoom know that in 2008, I had my first incident of back pain. And then in 2012, I underwent back surgery on my L5-S1 vertebral disc. I was fine for a while. And then the following year, I had my second back surgery on the same disc. 6 weeks post-surgery, I started developing a pain in my foot. It took about 8 months for doctors to finally diagnose me with CRPS. And during that time, I went to specialist after specialist and was given pain medication after pain medication, antidepressants, muscle relaxers, sleep aids, you name it, I had it. And there's a small glimpse at the 3 rows of pills that I had there. Eventually, after being told that I would never get better and I would just have to deal with it, I decided that I would kind of go against some of the things that my doctors had told me and attempt to push forward. So instead of fearing touching my foot or putting my foot down, I would try with something as small as a single step each day to try to reclaim my life. And finally, in 2016, I was pain-free. The thing about this whole journey is I really did lose myself, as I discussed in that analogy with the Play-Doh. I spent every single day on the couch at my father's house. I had moved home from college where I was actually going to play Division II football, and was just there in agony most days. The only thing that I did to entertain myself was open Yu-Gi-Oh cards that I would order from the internet. And, it was just a cycle of taking pain meds, reheating my warm sock to try and calm my foot down, and barely eating. Maybe a protein shake a day was all I could stomach. So yeah, I lost who I was and what made me me. And that's a big part of getting our life back. I don't think she's in here, but there's been a few great comments on YouTube on Facebook that I've seen during this week, and I want to share some of them. So, what makes you you? Okay, so Kelly from Facebook, she had commented, that when I said last week, if I'm in pain doing nothing, I might as well be in pain doing something, that it really hit home for her. And that's kind of the mind frame that I got into. And Matt, you had just mentioned this before we restarted and everyone came back in. You kind of reach this point where you say, "Man, if I'm going to be in pain like this, I'm I need to try to live my life in some ways."
You
Um,
bet.
and and so having goals on what those ways can be really important. So I took a look at Kelly's Facebook and I let her know that pain has a tendency to take away parts of ourselves that make us unique. Okay. What is that? What is it that makes you you? What is it that made Kelly Kelly? CRPS doesn't define Kelly, but it has tried to define her and all of us for the time that we've been suffering. So I realized during my journey that I had lost what made me me. So eventually, I said, if I really miss going to the gym, so why don't I just go and bring my walker? That was a big catalyst to my recovery, was that reframing of like, okay, it's here. The only thing I can do is try to move forward. And so with Kelly, I suggested, she is the person who's a great decorator. She had um, amazing interior decorating on her page. She also had two big huskies, and she also had posted a picture of a deck that she had just redone. And yeah, that's the Kelly that we're trying to bring back, and that's the Cheryl we're trying to bring back, or the Donna, or the Matt, or the Jason. And so over the next few weeks, I want you guys to really brainstorm, who are you? And what I mean by that is, who are you with outside of CRPS? CRPS is a friend that you didn't invite in. So let's find out who we are again and kind of push them to the door. So I want to celebrate a few wins that we've had. Lori, I think you're in here. Oops, sorry. Lori, you had mentioned that you went to work for the first time since 2022, and that your feet were swollen and on fire and hypersensitive, but you were happy that you were up and out of the wheelchair, and doing things. And that's a 1% improvement. That's a victory that we want to celebrate. Same thing with an anonymous commenter who said that he couldn't lift his arm up for years, and after just watching the video yesterday, he seemed to have the courage and was able to have the range of motion. Jeanette, I think she was in here, Sophia, or I don't know if they've been able to join again. Um, but she talked about how this knowledge has been helpful for her daughter, and her daughter had once been out of pain, and so she's had another onset here, but she's more hopeful, and that's going to make a huge difference in her recovery. And then Kelly, same thing from the last post right there, just a victory I want to celebrate. Okay, so why am I celebrating these victories? Because 1% better every day ends up being 37 times better in a single year. Okay, I want you to just think about that change. So let's say today, and this is where I started out. Um, all I did when I was at my worst with my pain was practice crunching my toes 10 times. And for me, that was 1% better because I hadn't crunched my toes at all. And even though it hurt, I did it. And then the next day, maybe 1% better was 20 times. And then the next day, maybe 1% was putting my foot on the ground. It might not be that fast, and it certainly wasn't for me, but I want you to think about, what is that? What does it makes up the 1% for you? And it might not even have anything to do with your limb. So for example, 1% better could be, today I sat up and I painted for a short time, or today I was able to take out my camera that I used to love using. Or tomorrow, to get 1% better, I will drive to the area of the river I like to sit next to before I had pain. Just finding those little pieces of yourself and putting them back into you. And this is important, and it is improvement because of the way it magnifies that compounding effect. And so I want you guys to remember that on those days when you're feeling down, like, hey, I didn't do much of anything today. If you did 1%, that's a win. Okay. So let me show you some examples of 1% better, what that might look like. Okay. So this is one of my virtual clients, virtual patients, and this is her in the beginning. trying to touch her foot with a Kleenex. You saw this in the last video. This is simplifying. This is 1%. At first, all I asked her to do was touch it 10 times twice a day. So here it is, and I have the sound this time, I think. So let me know if you can hear it. Could you hear the sound?
Yes.
Okay, here we go.
You just wrote 7, I thought.
Not mine.
There.
So there you go. That's it for today. That was her second round of 10 with a Kleenex. That's 1%. And as you can see, she was crying at the end of it 10 times and she was crying. But I want to show you a few weeks later how that 1% compounds. Okay.
You're doing awesome.
Okay, so you can see she's in pain, but she's taking steps. She has socks on, she has Crocs on, and she's starting to walk. Now, there was a lot in between these things, which I'm going to show you right after this. But this is how I want to encourage you. If you watch her face during this, I'm gonna mute the sound. Watch her face. What kind of thoughts do you think are going through her head? I mean, there's probably doubts, fears, motivation, pain, wanting to stop. You can see all of that crossing over her face. Sorry, say again.
I think smiling because she's doing it.
Yes.
Mixed in there.
Yes. And she's very lucky. She had two fantastic and amazing parents that made my job very easy. But she had this motivation, this hope that at the end of it, I'll be myself again. I have all these goals, and this is what I like to do. This is why I'm having you guys do it. I have all these goals of who I want to be when CRPS is gone. And this is my step forward towards those goals. Okay. And then right here is towards the end. Okay. And you can see not only is she doing her body weight and walking, but she's holding weights. Okay. So simplify when it comes to the pain that you're experiencing. Simplify and try not to overthink this process. But at the same time, a lot of you have tried some of these things in PT and felt like it's made things worse or felt like it made no change. That can be a consequence of not understanding why we're doing it. It can also be a consequence of not having it properly aligned with who you are and the goals that you want to achieve. So for example, oh, I got to figure out how to, there we go. For example, returning to ourselves. So she had all these goals of wanting to swim again, wanting to be out in the garden again, wanting to do all of these things. A lot of us, what we'll do when we're in pain is we'll try to full send going into the garden again, and then we just end up in a flare up. And so I don't want you guys to full send it. Okay. What I want you to do is I want you to ease in. So look at her here. She put on her bathing suit, even though she probably knew she wasn't going to be ready to fully get in the pool. She's got her feet in the water. And I think she only kept it in the water for maybe 20 seconds today and then took them out of the water. Okay. That is a starting point. That is also desensitization. These little tiny things. And then another thing, she liked to paint, she liked to draw, but she also liked being in the garden. So here she is doing both. She set up her little work area. She went out there on her crutches and she's in the garden and she's painting. This is helping her heal. This is 1%. She's going in the garden with her mobility scooter. She's going in the garden with her crutches. So she's returning to life, even though the pain is not gone. Okay. So that's 1%. And you see after time and time of this exposure, slowly each day, things start to get slightly better. And even if the pain stays the same slowly each day, at least you're inundating your life with more joy. And so this is, sorry, go on. I think someone just said right. so that's good. But this is her towards the end here. Not only is she in the water, but she's using a climbing wall.
Push up really hard with that leg, straighten it out.
And she's got
there you go.
A water boot on at this point.
You got this.
But by the end of it, she was doing this climbing wall
Leg
without that.
strength.
Nice, awesome.
Wow.
Leg.
Okay.
Good for her.
Yes. So I hope this gives you guys some inspiration. Okay.
Yes.
All right. So remember who you are. Okay. So she was someone who liked martial arts. She is someone who enjoyed singing in the talent shows, and she is someone who enjoyed going to the trampoline park, and having fun with her brother. And this is her at the end of all of our treatments. Okay. And by treatments, I mean, like I said, this is someone who I never touched. Okay, this is someone who I talked to, and I helped understand what was happening, and I reduced the fear behind what was happening, and she got better. And this is something that we all need, and I'll show you why. Okay, well, actually, before I
Case,
go to
can I
that,
ask a question?
yeah, go ahead, go ahead.
Just inquiring, was she also seeing her own physical therapist along with your treatment?
I was her physical therapist, treating
You were,
physical therapist.
okay.
Yeah, yep. And then she had, when I evaluate patients in this way, it'll be with a team first, psychology, anesthesiology, or just an MD, and then myself. And then over time, it's really, the path usually is just physical therapy and maybe a medication like gabapentin or Lyrica as like a bridge. But it depends on the person. And the medication, I emphasize, is used as a bridge. It's not used as a road. Okay. I don't want to just band-aid the symptoms. I want to address the symptoms is usually my goal. Okay. So as an inquiry, for some of you guys, I'm going to exit out of the PowerPoint real quick. What does 1% better look like to you? What if some of you give me some examples of how could you be 1% better tomorrow? What could you do?
Walking around the block.
There's one. Yeah.
Yeah, what? I'm trying to think of something. I'm trying to think of
Anybody else? Jason, you look like you got a thought on you.
wiggling my fingers.
Okay. That's 1%. That might be what we have. Wiggling my toes was 1% for me at one point. What else? What do you enjoy, Jason? What kind of things could you attempt even now with
gym.
all the pain you're in? The gym. How
Yeah.
how would you get closer to the gym? Like, let's conceptualize that. At the,
I've been going all along. I've been engaging my left arm. So I just go and push through and try to adapt the weights in different ways that I can do it without my left side.
yeah. And maybe we look at, depending on the situation, look at, even if we can't do the same thing on the left side as the right, maybe while we're at the gym, we have a really, really light weight or something that we attempt to grab or move or anything as a starting point.
Me too is leaving the house on my own with my sticks and walking a little bit more, just a little bit more. I've done it once or twice, but I can't walk far, but I'm trying.
Good for you.
I love it.
It's
I love
hard. It's hard.
It's very hard. It's very hard.
One other thing is that my goal, I do have a long-term goal. I haven't driven for 13 years. And with all the various operations and this and that and the other and the CRPS, I've been putting it off and putting it off. Now we're back in England. We've got a car and I want to drive it. But I am scared to at the moment.
So what could you and your husband take that car to a parking lot or somewhere where you could just drive
There
it?
you go.
That's what we're thinking of doing. Where he works, they have a private car park, and on a Sunday there's nobody in it, and he can get in it. So that we're sort of thinking it through how to do that. I could just drive around the car park a little bit. I want to do it, but because I lost all my confidence over the years of going out and doing stuff by myself, I need to push myself to do that.
You do it.
I will try. I will. I promise I will try.
We don't want to see you on the 6 o'clock news, though.
No. My husband is here and he's rooting for me. You know, he doesn't push me too hard, but he says, when you're ready, when you're ready. And I just need to get it in my head that I can do it.
Yeah. And that's the thing. Like sometimes we think, well, I can't drive and I want to, and our objective is like a road trip, you know? Um, if I say I'm unable to walk, I can't set my objective at a marathon. My
No.
objective has to be a single step. So with driving, maybe even just going and sitting in the driver's seat is the start. You know what I mean? And then you get out and then you start again
I've done
tomorrow.
it once so far.
There you go.
I
Just
will
feeling
do
the
it.
steering wheel,
I
you
will do
know?
it again.
Yeah. So that's a start. And I love all of these things and these ideas that you guys are sharing. And I think that anybody that's watching in the after recording can do the same exercise. What's 1% look for like for you today or tomorrow?
Happy birthday to you.
Okay. Let me go back to sharing my screen and I'll continue on here to explain why this is so important. Okay. Let's see. Okay, so we've established what 1% better might look like. Now, why is this important? So CRPS is perpetuated, the condition, by a cycle of negative and fear-inducing information. So what happens is we get this diagnosis and then we get no information, which is scary in and of itself. And then we, not only that, but when we go to seek information, we go to websites that are run by patients, or we go to support groups that are with only patients or very few providers. And what happens is we keep getting this, we reach out for support. And then when we reach out for support, we might get a little bit, but then what we usually get is like, welcome to the club. This is CRPS. Here, this is what happens. It's just part of it. And that kind of information doesn't help our experience of pain. Okay. And so what we have to start doing is we have to kind of break this cycle by thinking about opportunities to start moving towards confrontation and less fear and recover. So what happens? We have initial injury, some of us. Then we end up having a pain experience. We're having pain. And then what happens is we get negative information, threatening illness information. That creates fear. That creates avoidance. So we don't drive, don't touch our limb, don't do any of it. And then we have disuse of the limb, our body, our lives, and we have depression. And then we have pain again. And it's a cycle. We're stuck in a loop. So what we need to do now is we need to consider what are ways that we can move towards confronting what's going on, reducing our fear, and that will put us on the cycle to recovery. Okay. Now, next one. So some other ways that we can address pain. I want you all to imagine right now, and this has to do with our dysregulated nervous systems. Imagine in this moment that a lion was to bust into your room. Okay. How would you react?
Yeah.
Flight,
Yeah.
Do you say fight?
fight or flight.
Yes, exactly. Fight or flight. So that lion busts in. We're either fighting, or running out the door as fast as we can. And what happens is our heart rate speeds up. We start breathing like really fast. Our muscles tense up. Okay. Our blood pressure spikes. Our digestive system shuts down. We certainly don't want to sleep. Okay. And this is us stuck in fight or flight mode. Our sympathetic nervous system is overreactive. Now, none of us have a lion in our room right now, physically, right? But we do have lions in our life. And the thing is that our nervous system does not know the difference between a lion in our life and a real lion. Okay. So can some of you tell me what lions are in your life right now and what stressors, what negative things that are affecting you or difficulties are affecting you, even outside of CRPS?
Does it have to be outside CRPS?
Well, it can be the things related to dealing with CRPS for sure.
Yes. Well, because of the CRPS location, which is my groin, it affects everything from urinating to walking to every step is agonizing. So to this point, and I'll be perfectly honest, to this point, the doctors at Emory University diagnosed me with CRPS, but I don't believe that it is CRPS. I have a nerve in my left testicle, which, if anything puts pressure on it, I'll be in bed for 2 weeks with an ice bag on it.
Mm.
I've showed this to doctors left and right, and everybody, because of CRPS, has just said it's got to be CRPS.
Mm.
Do you have it on other places?
Because I have it in other places. They just
Assume that's the situation.
yes, exactly. They go
Gotcha.
a certain degree, but will not go any further than to do a few tests and say it's CRPS.
So some of the lions that might be involved in that would be feeling unheard,
Of
feeling
course,
doubted. There's frustration that comes from that.
have
There's
self-doubt.
self-doubt, yeah, and that stems to other areas of our lives too. And so what I would say in that situation is what kind of things can we do outside of the CRPS aspect of it to improve our I guess self-belief, the opposite of self-doubt. You know what I mean? Like
Correct.
what kind of things are there? Because that's something at this point that's very difficult to change, right? Because it's what's been happening. You said yourself, you've been
Yes.
to a ton of doctors. So
I
there
would
comes a
love
point.
to being a former military person. I would love to, with anything having to do with the military, it was identified. You tell me what to do to fix it, and I'll fix it. But
Gotcha.
as of now, the identification of whatever the problem may be has not been done. So I don't know my parameters when it comes to walking too far or going too far until it is too late and I've gone too far.
So that'll be self-determined information. So it's a
Yeah.
so what I would say is it might be one day you go, like, let's say right now, how what do you think might be too far? What do you know for sure is too far?
Half a block.
Half a block. Okay. So can we do a quarter of a block?
Yes, I did that today, as a matter of fact.
Perfect. And so we know from that information a quarter of a block is okay.
Yeah.
And then tomorrow we attempt a third of a block.
Yeah.
Okay. It's a little bit bigger. And then we try 2/3 of a block, right?
Yes.
I know it sounds so wild and so silly, but
No, when
I
you said that, it just sounded a little funny.
Yeah.
It's a little bigger.
Yeah.
What I was trying to do.
But when I was going through it, when I finally was walking a bit again,
Sure.
I would take my walker out to a bike path, and I would use a piece of chalk to mark how far I got before I felt like I
That's a
might need
great
to give
idea.
up. Yeah,
Good
and then the next day I tried to beat it, and the next day I tried to beat it, and then what's
That's a
cool about
great
that?
idea.
What's cool about that is eventually it rains and it washes my chalk away, and then I get the experiment of guessing. Okay. But sometimes these rigid parameters, which I know is very soothing for us in the military and also for me with ADD, sometimes these rigid parameters might be the thing that hold us back.
Yeah.
Matt, I'm sure there's times in the military when people go into battle lacking some information.
Of course.
And those battles are still won. And so that would be my encouragement to you is the information might come secondary. You might have a day where you try that 2/3 a block and you have a flare up, but I promise you that is not restarting from square one. Okay. That is information for you to say, okay, 2/3 a block is a little too far right now. I'll go just under that, even if it's 10 feet. And so that's what I'm encouraging for everybody, especially with these unknowns. The unknowns are the unknowns. Our only option is to try to move forward. Okay. And okay, so that's one lion. What other lions might we have in our life? These lions can be marriage, financial. What else? Work.
For me, it's workers' compensation. My injury initially happened in 2021, and I was on workers' comp. since then, I've been terminated from my position for not being able to return from FMLA. And I'm still battling workers' comp now. It's kind of an everyday battle with them trying to take my benefits away.
Yeah. So that's a lion of arguments and more unknown and
Sure.
fear of our livelihood.
The insurance
Exactly.
companies.
Yeah, that's a difficulty for us. What else? I'll continue with that, but what else do we have?
I'd say logistics.
Uh-huh.
I mean, it's difficult, especially for my wife, because she's the one that is lining up all my medical appointments, my medical records, in order to take those to each and every appointment. And that's a lion for both of us.
Yeah. So yeah, taking each of these lions, breaking them down, maybe even making a list of what are the lions in my life, and then finding a way that we can gain some feeling of control over some of these. What are some small steps, just like our small steps towards function, but what are our small steps towards a reduction of stress in our lives that
Sure.
can turn the tide so we can be like the second zebra here. And the lions aren't really attacking us. Instead, we're facing them. The reason that is because, like I said, when a lion is chasing you, or or the lions in your lives are affecting you, you're breathing fast, your blood pressure's up, your muscles are tight, you can't sleep, you can't eat. But the more that we start to turn the tide on those lions, the other nervous system, the rest and digest nervous system, parasympathetic, that starts to quote unquote, wake back up again, start functioning better again. And if we can try to find even a fraction of control over some of these things, our rest and digest will get better, our sleep, our digestion, all of those things. So that's something to brainstorm. What are the lions in your lives, and how can we turn the tide on these? Okay. So I'm still going to answer a lot of questions, and we're going to talk some more. Whoopsie. But I want to talk about what's going to be next for episode 3. Okay. We're going to go into a lot deeper when it comes to the pain experience. Okay. So this right here is the 9 different areas of your brain that is involved in pain. Okay. And so some of these you can see when we have pain, it affects our concentration and our focusing. That can cause brain fog, that can cause, and so medication can also cause brain fog. When we have pain, it can affect our problem solving and our memory, because all of our focus and attention is on this pain. Fear and fear conditioning can affect our pain. So, like I said, some of the messages in these groups can create more pain for us. Our stress and our motivation can affect our pain. Pain can also affect our movement, and our movement can affect our pain. So it works 2 ways. The good thing about this is that if we take some of these things like fear and reduce it, we can also reduce our pain. If we take some of these things like stress and reduce it, we can also reduce our pain. If we take something like movement and do it more, we might be able to reduce our pain as well, because there's that information for us. So when we start to expand more in episode 3, that's what we're going to talk about. We're going to talk about taking the complexities of pain and simplifying them for us. Okay. So let me go to the chat. I want to see if there's questions real quick. Yeah, Lori, I do see that sometimes on the support post. Lori mentioned probably earlier that it sometimes becomes a competition in the support groups who has the worst pain. And that can be really hard for us, because we get fixated on, like, not only is it, oh man, they have this really bad pain, but the messaging behind CRPS is that's where I'm headed. We get this feeling of like, oh, if their pain is that bad, that's where I'm going to be. We feel like it's going to progress in that way. And that's just not the truth when it comes to CRPS. Okay. That not everyone shares the same fate in those ways. And a lot of people recover or get to a point where their pain is manageable enough that they can live life. And those should be our goals. Those should be the things we look towards. Okay. Any other questions that people want to ask?
I have a question.
Yeah.
So I know I had mentioned it last week, but I have a mechanical issue. I have degenerative disc disease.
Mm-hmm.
I'm just wondering if they go hand in hand or if one has nothing to do with the other.
Okay, so this is a perfect example. Degenerative disc disease. It sounds scary, doesn't it?
Oh yeah.
Okay, so degenerative disc disease is what it sounds like. The discs within your back are quote unquote degenerating. The thing about degenerative disc disease is that is not indicative or causative of pain, and I'm going to show you proof of that. Okay. Um, so give me 1 second. I'm going to share my screen again.
I do notice they're different. There are two different types of pain, if that makes sense.
Yeah. Well, here, let me show you. Can you guys see my screen?
Yes.
Okay, so this is my website, thewindowpane.com. In my research section, I talk about things like bulging and herniated discs, meniscal tears, and arthritis, and how they do not cause pain. You can call me on my bluff, but here is the research behind it. So you can click any of these research studies, and you can go to the research.
Okay.
And I'm going to find a image that's inside this. So in this research study, they took 3,110 people and they scanned their backs. Okay. They did an MRI. And you can see here this table. They had people from ages 20 to 80 of those 3,000, and they looked at how many people had disc degeneration. So take a look at this. Of their group of 3,110, 600 in their 30s had disc degeneration, 300 in their 50s, 80 in their 60s. Okay. Disc protrusions, 460, 490, 360. Look at all of this. That's a ton of people with these changes, right?
Mm-hmm.
Let me tell you something about this study. In order to qualify for this study, you had to have no pain at all.
Oh, okay.
So my point with that is the things we claim are causing pain in even in the medical field, research shows that those aren't always causative of pain. They're one potential factor, but if all of these people had those degenerations and didn't have pain, it's more likely that these are normal things than they are things that are causing your pain.
Interesting.
So, and this is all over my website. So you can, like I said, you can go to thewindowpane.com and you can see some of those studies there. I repeat that showcase for the shoulder, for the hip, for the elbow, for the knee. Okay. So for example, if I'm in Texas, if I go down to the Rockets basketball team and I pull 30 of those players that aren't in pain and I scan their knees, statistically 11 of them will have a torn meniscus, but no pain.
Mm-hmm.
Okay. So like I said, the key to missing the big picture is to look at everything close up. That mechanical, quote unquote, mechanical issue in your neck, that's been framed to you improperly. Okay. Because if I scanned my back right now, guess what I would have? Degenerative disc disease.
Mm-hmm.
But that's a normal part of life. Everything's degenerating. Look at my forehead. You see this wrinkle? Can't see it, but it bugs me a lot. Okay. My skin is degenerating. I have degenerative skin disease and degenerative hairline disease. Okay. But that happens within the body too. But that doesn't mean I don't get headaches because I have this wrinkle, you know? It's not necessarily the reason that something's happening just because it's there. So
I think
I'm
sorry, go ahead.
No, you're good.
I think that the confusion for me is when you have more than one, you have several doctors and one, of course, specializes in one thing, one another and another. And then, when you have pain in a certain area, which mine is spread all over now, but, you associate that with, degenerative disc disease. If they tell you that's what you have, then,
Sure.
Does that make sense?
Yeah, and that's a lot of what I do as a physical therapist is unwind these not necessarily true beliefs. Okay.
Mm-hmm.
There's a lot of things out there that get told to us that aren't necessarily actually true when you flesh it out in the research. And so I want to let you know that your spine, from what you've told me, obviously I haven't looked at it on an X-ray or anything, but a degenerative disc disease is a normal part of life. It's a normal thing that happens. And so I want you to know that as a physical therapist, if you came into me and that was something you were held to, I would say, well, hey, if it's degenerating, then there's nothing you can do but strengthen things up, and we'd start working on strengthening your neck or moving your neck.
Right.
That's the answer. And so I want you to know that, and I want you to, like I said, keep it simple. If you notice something you can't do, we work towards doing it. Does that also apply to osteoarthritis? I have it in most of my joints. Yeah, Cheryl, we all have arthritis.
No, osteoarthritis is quite different as far as I understand, in the way that it doesn't affect all of your joints in a symmetry pattern. It can be very random. My mom has that, her mother, and so on and so on. A lot of my family have it too. The reason I had my main first foot operations was because over years, and it was years, I was very, very active in my younger years. But as I got older and I still started to do more and more things, I could barely walk. And by the last 2 or 3 years, I could barely walk.
Mm-hmm.
Tried all sorts of painkillers. Majority of them I was allergic to, and I couldn't really take them. But I literally could not walk on that foot. It got so discomforting. Okay,
Yeah.
I don't like to use the other word. Yeah,
I like that.
Really bad. And they looked at it and they showed me the images and everything, how it had like all gone horrible inside in the midfoot. So it's midfoot fusion that I've had done, basically. Okay.
Yeah.
So carry on, please.
Jason,
Yeah,
I have
no,
a question for you.
Sorry, 1 second. Let me reassure Cheryl here.
Please.
Very quick. Okay, so I want to introduce you to something.
Okay.
So if we have any type of degenerative condition or arthritic condition or anything where bone is breaking down, I guess.
Mm-hmm.
The answer to helping with that is compression and use of something. So in order to build backbone, we need to put our weight through bones. Sometimes we do get to a point where, there's a surgery that needs to be had. Sometimes that is something that happens. But the answer is still going to be like say someone comes to me with osteoarthritis and they aren't at that point that you were at where it was felt that you needed to have a remodeling or a surgery. I would tell them that the answer is putting weight through things and putting tension and compression on a bone. Oh, this is opening LinkedIn. To put the body part under stress and then stimulate the growth of more bone.
I did that.
Yes.
Many times with weights and everything.
Yep. And sometimes there's a point where surgery is warranted. Like we see that with knee replacements and hip replacements, right?
That was my knee as well, which I've just had.
Right. But you're gonna put off those kinds of things more if you're continuing to exercise. So the fact that you kept exercising probably gave you more time before you needed that change or that correction.
Yeah.
So yeah, Wolf's Law. When a bone is under increased loading, it will remodel and become stronger.
Okay. I will look that up and digest it, and then just I'm trying to stop it happening in my left knee, which it's there, but I'm trying to do all my exercises and weights and everything to try and stop it.
Yeah. And people get knee replacements. My dad's had them both done and that kind of stuff. And they're wildly successful a lot of the time. Okay. Who did we have? Donna?
Would that apply to I have spurs up and down my spine, and I've gotten like 3 different orthopedic surgeon opinions. The first one basically told me he felt I'd end up in a wheelchair. The second and third confirmed I'd be in a wheelchair because I push through it and I move, but it's non-surgical. There was nothing they could do. If they did injections or burning the nerves, they'd have to do it all the way up my spine. Like having a dinosaur spine is what I picture.
So yeah, well, what we picture, our perception dictates a lot of the way we feel in our reality, right? Bone spurs apply to that same thing of this is a normal part of aging and change, and they're not indicative of pain. People have bone spurs without pain. Do you have days where your pain is more or your pain is less?
I have 3 different areas that my pain radiates to. My left hip, my right hip, and down, I guess I'd say down to my hand. I've actually got 2 fingers that have gone pretty numb on the left side, but it just depends on if it's flared up. If it's flared up, it's painful to walk, it's painful to sit. It's one of those days I have to lay down the most of the day.
Yeah. So my point with asking that question is, if these bone spurs were causative of pain, you would always have pain in the same spot at the same intensity. But since you have pain that moves and it varies in intensity depending on the flare, your bone spurs aren't spontaneously shrinking or expanding. They're always the same size. They're always in the same places. And so it's hard to, for me, like logically, to attribute the bone spurs to the cause of pain. Does that make sense?
It does, but I can associate, I know that if I go out and load the trash up and make a dump run or something like that, I know I'm going to have the pain. So there's certain movements, or if I take a longer walk than what, I don't have the pain necessarily at that moment, but by the time I get back and I relax, I've got the pain.
So it would be the same concept that I was asserting previously would be, okay, so you've just given me things that functional tasks that are difficult for you, like loading the trash or going for extended walks. How can we modify those to get, or do something similar to get stronger for those, so that the pain doesn't come on? Does that make sense?
Yeah, I think probably the one I would enjoy the most would be extending my walk. Forcing my to do, because I live out in the country and just, dirt roads, and it's beautiful, and yeah, that's, I could see. So in doing that, it's kind of like pushing through the pain, just a little bit at a time, I guess.
Yeah. So pain is a bear, and sometimes it roars. And so what we want to do is we want to poke the bear a little bit, but we aren't trying to wake him up. And so we do, those bone spurs, whether they're causing pain or not, is kind of irrelevant because they're gonna be there no matter what.
Right.
Okay. So what we want to do is we want to, if a goal of yours is extending your walk, then let's start to do that little by little, just like Matt's gonna do. And we'll see how we fare as we go. And remember, if you have a flare up, there's other factors that contribute to pain, like bills, arguments, workers' comp, not being heard or listened to. It might not be the walk that day. It might not be the walk that made your pain worse. So just those are some things to consider. And like I said, there's some things that we can't change, like the fact that all of us have degenerating discs, or all of us are getting arthritis, or all of us have bone spurs probably somewhere, because they occur from pulling on the bone. So if we can't change it, our only option is to try. So to start extending that walk, I think that'll be a good project for you.
Thank you.
Yeah, of course. Okay, what else do we got,
Doctor,
guys?
Sir.
Yeah.
Question. I don't know what you would rather call a Chase or Dr. Chase, or
Chase is good. Chase is good.
Chase is good.
Everyone calls me Chase. Yeah.
Question for you. CRPS, when it occurs, doesn't spontaneously occur. It occurs after a trauma, a broken bone, surgery, so on like that. Is there a percentage wise saying that, okay, somebody has surgery now you're going to get CRPS or you're not going to get CRPS? Is there a percentage of how people get it from surgeries, from falling, from traumas? Is there a percentage of that you can physically look at and say, what are my chances of going to get a hip replacement and actually getting more CRPS?
Yeah, so there's not really a percentage. It's a pretty rare thing to occur. And there's not really a way that, from what I understand, that you could like avoid it happening. The way that I conceptualize CRPS is the body's had some sort of break-in, whether it's an injury, a bee sting,
Sure.
or just waking up and having pain that has happened. It's had some sort of break-in, whether physically, or mentally or emotionally. And because of that break-in, the alarm system of the body has become hyper vigilant and hyperactive.
Got it.
And so when you touch something or try to move it, the alarm system goes off, even though there might not be any reason for the alarm to be going off anymore, right?
Okay.
And this is the characteristic of if you have surgery, you're triggering the alarm. There is a break-in.
Yeah.
And for everybody after surgery, you'll have sensitivity. But for some people, for some reason, they'll develop CRPS. But the same process is true no matter who I see with CRPS. We try to calm down the alarm. And just like I said in the first Zoom, the only way to do that is slowly.
Sure.
Because if we just set it back off again, the alarm's going to want to upgrade.
Thank you.
And so, yeah, that would be it. As far as I know, I don't see research on like who's more prone to get CRPS
Sure.
outside of like the prevalence is a little more in women.
I
But
saw that. Yeah.
yeah. But the good news is what we're seeing now is most people get better from CRPS with the right intervention and the right team around them. And better can sometimes look like just a little 1% each day for a while. Okay.
How often will we be doing these Zoom calls?
So I want to do 4 more. I did last weekend. I did this weekend. I'm going to be gone for 2 weeks. Then we'll do another one.
Okay.
I'll put the full schedule out on Facebook and stuff so people can see. But yeah, I'm going to do 4 more. I'm going to do some editing of this one since I have the recording from the beginning that I need to sift through. But that'll be there for you guys to rewatch. And then I'm gonna do 4 more. The 4 more that I do, they'll be a little spaced out, okay? Because I want to like kind of give some homework like I did this time. And then in February, I'm working. I work 3 days a week at the hospital. And then every day that I'm not there, I'm working on this. But I want to make a 8-week self-guided online program for you guys to be able to go through with videos where I'm speaking, like just presentation type educational videos, as well as worksheets that you guys can do and a discussion board. That's going to be one version of what I'm creating because right now, like I said, I can only see 30 people, but with something like this, I could potentially help thousands, and then the other version that I'm making is going to be 8 weeks. But I'm going to be there with you during those 8 weeks. And so we'll run that version in like cohorts. Let's put it that way. So let's say we'll have like a couple groups of, 10 or 20, like we have here. And you'll go through the educational material that I'm making and the worksheets that I'm making, and homework. And then every Saturday during those 8 weeks, we'll come together and we'll talk about questions, concerns, how you're faring through the program, and those kinds of things. Right now, the only other program that I see that's out there, is Spiro Clinic, and I think Spiro Clinic is charging people $100,000 or something crazy.
Yeah.
And so, for me as a physical therapist, to come see me at my work, if you were to come to Texas Children's, if you paid out of pocket, it's somewhere between like, I want to say $130 to like $700 or something, something wild. I don't get that, but that's what the insurance is putting out to my company, right? for this program, I want to price it self-guided around like 350. So the price of like 2 visits, you get all the knowledge that I've acquired over the last 10 years of my own experience. And you get me guiding you through it as best as I can. So I want to reach as many people as I can with this and give you something that can be very affordable. And we can kind of form a family in that way where we can get better and look towards the positive in the 1%. You code it medically for PT services. So it wouldn't, I wouldn't necessarily, I'm still looking into that. I wouldn't necessarily call it PT services. I would call it more like pain coaching. But if I can do it to where insurance could cover it, that would be super awesome. So that's something I'm looking on into. This idea is something that came to me by encouragement of one of my coworkers. And so I'm really just like going full bore. Yeah, FSA or HSA. I want to look into that, Trisha. I'm going full bore right now to figure out a way to make that happen. Because $100,000 is crazy. And so people can't afford that, and there's people suffering. And when I was going through it, I definitely wouldn't have been able to, I can't afford that now. So, but yeah,
that's exactly why they're charging that.
Yeah. Yeah. Like an exclusivity thing. Is that what you're saying, Matt?
People are suffering and they have no way out. And if this is going to help, they're willing to pay anything.
Yeah. Well, I want to help people, I want to think of a price that people can afford, and be able to use. And so that's my goal with this program. And that's why I've, got my website and that mailing list, which I think that got, I'm going to put it in the chat one more time so you guys can sign up.
We signed up.
But yeah, I'm very excited about this. This is kind of like reinvigorated my love for the profession too, just imagining how many people I could reach. So please do sign up and I'll work very hard to make sure that's ready by February.
I have another question.
Yeah.
So when I had spoken to you last week, so these concepts of every day, does that apply to like I think I have fibromyalgia, even though I've been diagnosed with, or AMPS, even though I've been diagnosed with CRPS, because I don't have a limb issue.
So yes, these kinds of concepts do apply. You have pain. It's there. You're living with it. You're struggling with it. Getting 1% better will help the pain, whether it's in one limb or in your full body. And what you're doing where you signed up with that therapist too, and that is going to make a big difference as well. So I'm very excited for you to work with her. But yeah, these concepts do apply. And there might be a situation where, I make another program someday for AMPS, but it's going to overlap a lot with the things that are in the CRPS program. Because as you can see, I've encouraged us touching and moving our limbs, but I haven't gotten quite into specifics yet. And so a lot of this stuff applies, not even if it's, addressing a limb in particular. Like I said, you're not a hand, you're a human.
Right.
And there's other things that make us up. So yes, it will definitely still apply. Amy said, what are your thoughts on dry needling? What I always ask my patients, if they ask me this type of question, is I say, what are your thoughts on it? And the reason I say that is because if you have heard good things, if you feel like it has been helpful for people around you, if you feel like it will work, it will probably work. If you have heard bad things, if you are skeptical, if you feel like it won't work, then I wouldn't necessarily try it. So I ask my patients when they come in and they say, hey, do you know how to do cupping therapy or something like that? I say, yeah, I do. What have you heard about it? And if they're like, I don't know, I say, yeah, we won't do it. That's really my take, in all honesty. There's a lot of modalities like that, and that's my take on all of them. Belief is a powerful thing.
Do you believe in or think it's a good thing to utilize the infrared saunas or the red light? I've used it and it seems to be helping me.
Perfect. And that's Yeah, if it
Yeah,
feels
like you
good.
just said, if it helps, it helps.
Yeah, I've had patients where it was in their culture it was normal to put onions around an area that was in pain.
I've seen that. Yeah.
Yeah, and it helped. They tried. I said, try it. I'm not against whatever you want to try.
Sure.
And they tried it. And I'm especially not against something that's non-invasive. Okay, so holistic kind of things, or
Yes.
like red light therapy or saunas or cold exposure, those kinds of things. It's all very non-invasive. And I say give it a shot. And especially if you've heard good things about it, then of course. So Amy, that's my answer. If you feel like dry needling might be helpful for you and you've heard good things, give it a try. For me, I was learning dry needling in school and I put it I put it in my arm and I passed out because and funny enough, I'm tattooed, but for some reason I don't like needles. um but yeah, but for some of my patients, they love it. So yeah, that's my opinion.
Hi, I'm Laurel. I don't know if you can see me.
Yeah. Hey, Laura.
I'm Matt's wife. So
Hello.
we have for that one clinic, the one that's 100,000, we've also looked at other clinics that were like 40,000. So I basically did a spreadsheet and I looked at the commonality of the treatments that they're all doing and wrote that all down. And there was a lot that they're doing that each of them are like repeating. So then I started doing a little research, and ironically, within a mile of where we live is a brand new thing called iCryo. And they're just opening up, but they're all over, including Texas. And it's a membership program where they're doing non-invasive treatments.
Mm-hmm.
So for instance, they're doing the red light therapy.
Yeah, exactly.
They're doing a red light sauna. They're doing cryo. They're doing the oxygen one. And like, for instance, you could get 16 sessions in 1 month for $170.
Yeah, so something like that, those alternative things, they're non-invasive. If you feel like it's something you can afford and want to do, try it. But I want to let you all know that there is no quick fix for something like this.
Right.
Okay, and so there still needs to be, and I talk to my patients about this all the time. There still needs to be putting in certain amounts of work with trying to move, trying to touch the limb, as well as the work from like our social elements of our life. Some of us have been isolated for years because of this pain. It's going to take some exercises and some reflecting and some cognitive adjustments.
I spend an hour a night just doing fascia movement in and around the areas, just to loosen everything up, because it's usually like a rock.
Yeah. Yeah, I agree. It's gonna take time. I don't want anyone to think that just doing a couple of these things is gonna fix things. It takes time. There was the article that I've shared a few times about someone's dog. Okay, the article that I've shared a few times about the barrel racer that I helped get better.
Yeah,
it took 2 months before she started to see some reduction in her pain. And so that's I just want to let you guys know that sometimes that's the process. It's not going to be a quick fix. The alarm is hyperactive. We have to calm it down. Thoughts on scrambler therapy? Same thing. I've had patients who have come and said that it was really, really great for them. And if they feel like they have a belief in that scrambler therapy is going to work for them, I think that is a great resource and something they can try. And that a lot of it depends on that and your knowledge of what's happening when you're having scrambler therapy. So you want to find someone who's good at explaining to you what's happening, explaining to you pain. There's actually a gentleman that reached out to me named Maxwell Wessenberg, and he
that's who I went to.
Yeah, and he's very knowledgeable in pain, and we've been in talks about ways he can help educate his patients in pain. And he's also talked about possibly, whenever you sign up for Scrambler with him, getting my program to do on your way to going to visit for Scrambler. And so, that's something, but kind of the same thing. I've heard good things. I've had patients who went to scrambler therapy and got a lot of relief, got 70-80% there, and then we did some extra stuff and finished it. But there's also been people who have gone to scrambler and not seen as much benefit, or or been upset. And the thing about that is it's not necessarily the device or the protocol itself that might be at fault there. It might be even the type of provider that's providing the scrambler. You know what I mean? Because if you don't trust what he's doing, or they're not caring for you or listening to you in certain ways, that can affect the outcome of the treatment. Okay. That okay. What else we got? Oh, hold on one second. 5 years of my PT. I tried. PT has one out. Oh, I love that, Amy. I'm so glad to hear that. That's fantastic. Amy said 5 years with my PT. I've tried many modalities. PT has won out by far. The reason I chose PT myself is because I knew I would have the most time with my patients. I'm going to stop my camera. Sorry. I would have the most time with my patients to actually hear their story and talk with them. My work gives me an hour with each patient. And I think that's so valuable to be able to understand and interact and learn about patients. And I think PT wins in certain aspects because of that dynamic. Exactly. He's my hero, knows me inside and out. That's right, Amy. What are my thoughts of ketamine injections? So injections or infusions?
Infusions.
Infusions. Okay. So infusions are used a lot. Infusions are used a lot in something else. Does anybody know what they're used a lot for?
I had
PTSD.
Drug rehab.
I had it after my during my operations because of the CRPS, and they knew that I would be struggling afterwards, so they injected me with it. But I felt awful afterwards.
Yes.
Felt awful afterwards. Okay.
Yeah.
So we have some people who have good experiences, some people who have had bad.
Horrible.
Yep. Yeah. And so there's a mixed bag there. And so your knowledge of it, how you're approaching it can have an impact, just like everything. Jason, correct, depression. So I have a friend of mine who lives in Colorado. He has no pain, no CRPS, anything like that, but he has gone for ketamine infusions as a therapeutic treatment for mental health. I think that it's striking that a lot of these mental health treatments, like ketamine, like gabapentin, like some of these other antidepressant drugs that can be given to pain. I think it's telling and eye-opening the close relationship between pain and our mental health as well. And so that's why a lot of the activities in the program and some of the things I suggest to you guys here are more of a mind frame and a mental adjustment than anything else.
Are you not a believer in gabapentin?
I don't mind gabapentin. If gabapentin helps you, then that's great. So yeah, pregabalin would be Lyrica. But there's a lot of my patients that start out with taking gabapentin or Lyrica for a period of time. And then when they start to feel better with PT, we taper off. For me, when I took Lyrica, I didn't like the feeling. But I have patients who swear by it. Okay. So I'm not, like I said, there's nothing I'm like super against. But I do caution people on like super invasive treatments. You know what I mean? Those would be classified as like what I would classify as like break-ins, like surgeries, ablations, stimulators, those kinds of things. Then again, some people have relief from those things, so I'm not writing them off. So yeah, Amy said gabapentin helps her. Cheryl says it was been awful. So yeah, there's medication's a bridge, not a road. And that's what we need to see as well.
I'm on the ketamine therapy right now.
Yeah. And Jason's had some help with it, yeah?
And
no?
yeah, I mean it's been the most effective therapy in terms of reducing pain and allowing me to work through my physical therapy myself. So far, I've had a spinal cord stimulator and it was not effective, and I had it taken out. I've been through most every treatment there possibly is, probably.
Yeah. Yeah, Jason shared his story with me, and I'm hoping he can find some value out of the Zooms and things as well. And that's an example, Jason. Some therapies have felt helpful and some therapies have not, and it varies from person to
Like
person.
there's my pick line right now.
Yeah,
Here's
man.
my IV friend.
Uh-huh. Is your wife still
So
in there with you?
she's over there, yeah.
There you go. That's the one helping us fight our lions. I love it.
That she's strong.
Okay.
Way too much.
So peripheral nerve stimulation. Sorry, I'm reading the chat here. Nikki, what do you think of peripheral nerve stimulation? The way we can stimulate our nerves is by giving them information, touching things, moving things. That's my take. If you feel like you've heard people have relief from a stimulator like that or something of that sort, then worth a try. But again, I don't like invasive things. So I would rather have things that are more natural, things that instead of things that are implanted or injected or anything like that.
Doctor,
Yeah.
question. The nerve, which is yet to be identified in my groin, for me to touch that would not be a good thing. It would probably send me to a couple of days in bed with ice pack on it. I don't know how. I've tried to go about the surrounding area to slightly touch that with gentle touches to move forward. It's insane. And like I said, I've for the first 18 months after that accident happened, I was like yourself. I ended up on the couch for 18 months with nothing but a remote in my hand for fun. So, and an ice pack on my groin. I don't know how to desensitize an area that is so lit up. It is impossible to approach.
So do you have so you said it extends to like a border of some sort.
Yeah, it runs my entire groin down both inner thighs to my knee.
Okay. Wow. Okay. So what I do with people, so for example, I have a patient who had surgery to remove a tumor back of her neck, and she had a scar on the back here.
Right.
And it was very sensitive to touch anything around there. Like she couldn't even have her hair touch it. Um, and so what I did was what you just mentioned, like an approach from afar with something as soft as a cotton ball, even to start. Okay. And just slowly touching with a cotton ball, touching with a pillowcase, slowly approaching that area. But
Sure.
in the same way with the walk, sometimes I might tell a patient we need to touch things more, and I'll mention the cotton ball, and then they'll go in with their hand and and touch. And it's like that's too fast, too soon. Okay.
Sure.
And so while you do that, while you approach from the border, okay, you might have days where there's a little bit of a flare, but I don't want you to get discouraged, because recovery does not look like a linear path. It looks like this.
It has been like that. It's been a roller coaster, and like I said, I've had weeks with horrible pain, and then I do that. I desensitize, I ice, I take my medication, I get back to a point where I am semi-functional. I get into the shower, I dry myself off, and with my towel hit that nerve, and I am back 3 weeks again.
Yeah. Yeah.
It's sometimes I don't even know what I do.
Yeah. So those will be patterns we'll try to identify, and
Okay.
maybe, as we go, try to figure out something. But I won't call it hopeless,
No, it's not hopeless.
Yeah.
It's frustrating.
Infuriating. You were going to say
You
infuriating.
bet.
Excuse me.
Say it. I understand. Yes.
Can I just mention, when I was really struggling with it in my limb, my husband would just hover maybe even a foot or so away from the area with his hand, and with my eyes closed, I could feel the heat, the warmth of his hand. And sometimes that was too much, so he would back off. But after days of repeating that, just knowing the anticipation of perhaps being touched would start to heal me, and maybe feeling the heat of his hand was starting to heal as well.
Thank you for sharing that.
Yeah.
That's
You're
like the
spot
same
on.
concept of Reiki. Isn't that like Reiki healing?
Yes.
Where it's just like hovering. Yeah.
So I would the way that I would describe that too is graded motor imagery. So where you sorry, where you imagine touching a space, right? So I have some patients that I've had where one patient in particular had CRPS in both hands, and he was a pianist. Okay, and so we would have sessions where we would imagine playing the keyboard. Sometimes when imagining playing the keyboard, I could see the color change in his hand in real time of imagining doing that, because your brain sometimes doesn't know the difference between imagining doing it and actually doing the action.
Sure.
And so, like Rolando said, when the hand is approaching, there's an anticipation, there's an imagining of it about to touch here.
Right.
And that imagining is enough to start to tell the brain, like, hey, this could be a safe thing to do. I could be okay. So maybe that's even a place you start, Matt, is imagining, what it might be like to touch that area, or, considering the area it's in, imagining or visualizing other things, associated with that area that might be safe or enjoyable, for the brain.
Sure.
That's another thing. I might try to get a resource from that mailing list to you guys about graded motor imagery, and some of the ways to go about doing it too.
All right.
Goodbye, Jason. Thank you for joining in. Message me anytime, man. And I'll see you hopefully next episode. Jason's hopping out, guys. Let's see. I got to go through some of these questions here. What about when it seems like you're improving and then you get worse out of nowhere? Anything from being able to touch your foot and then not being able to at all, to say the swelling goes up and down. Okay. So again, this is a faulty alarm. Okay. This alarm is going off for no reason. It's like when I was a younger guy, like around 2021, I had a little sports car that I put massive speakers in the back of. And when I would drive down the street, if I played the right song with the right amount of bass, I'd set off some car alarms. Okay. Some of those, I was rambunctious, but some of those cars had sensitive alarm systems, and some people have sensitive alarm systems. So just because our alarm is going off doesn't mean that everything's starting over from square one. And that's the thing we have to remind ourselves. When you have an alarm go off, I wouldn't call it getting worse. I would say that, okay, today I'm more sensitive, but I wouldn't call it getting worse. I would just say it's one of those days. And then the next day you start again. And so that's kind of the idea of reframing our mind from that feeling of defeat, which trust me, I completely understand. But that would be my answer, Chris.
I love it.
I'm looking through some things here. The FOME. I used mirror therapy. Yeah, mirror therapy is another concept of graded motor imaging. That's why it works. It's retraining the alarm. So for example, mirror therapy got popularized by Ramachandran, and he used it on amputees. They would feel like their right hand was closed, but their right hand would be gone. And so they put the mirror in between, and you look through it, and it tricks your brain into thinking you have a right hand. And then you imagine, graded motor imagery, imagine opening the hand. And actually with my patient that I showed videos of earlier, we did mirror therapy to start, imagining moving the foot up and down. And then what I had her do, I said, hey, don't move the other foot, just imagine moving it. And then I said, now we're going to move the other foot, but only like a fraction of the amount. as the right foot, the foot that's not in pain. And that was a starting point for her. Okay. So
That's
sometimes,
exactly what I did.
yeah, same thing for you,
with
Cheryl.
with my feet, and it worked brilliantly. But it took weeks and weeks and weeks and weeks and weeks. It wasn't instant. And also for the touching part of it, I could not bear anything touching my foot whatsoever. So I used the mirror therapy, and you can get an app for it now. You don't need an actual mirror. And you basically can touch the foot that is not a problem, okay, however you want to word it, and basically use the mirror therapy, but touch your healthy foot, but look at the other one.
Yes.
And that worked. It took time, like starting with a feather or something very, very light, and eventually I could actually touch the other foot properly with a feather, and that really, really helped.
Yeah, and it, as silly as it sounds, this is how the brain works and associates things.
Crazy, but yeah.
There's even a video, and I might send that out in the newsletter as well, of someone with a dummy hand, and they have the person looking at the dummy hand, and they hit it with a hammer, and the person yells in pain. And the brain's mapping is really interesting. And so that's why we do some of these things. And physical therapists need to get better at explaining that, because sometimes when we don't explain, people are like, what am I doing? This is ridiculous. Sorry about my camera. There we go. Let's see. Thoughts on CBD oil and gummies. Same thing. If it relaxes you, it's great. I have a really active brain. And when I was younger, because I have ADHD, when I was younger, there were things that relaxed me that I took part in. That's taking our fight or flight and reducing it. Okay. So if these things are relaxing to you or soothing to you, I have no problem with these things. Okay. Recognize. There's Recognize, and then there's an app called Laterality. Both of those apps are good for exercises in that way. Thank you for saying that, Amy. Amy, your physical therapist rocks. Okay. Anything else, guys? I think I'll actually start with that dummy ham video so you guys can see it next time. The next one is going to be, I'll keep answering questions, don't worry. But the next one is going to be the 14th of December. Or no, sorry. Shoot, 1 second. 37. It'll be the 21st, Saturday the 21st. We'll do it. But in the meantime, I'll send video snippets. I'll send some educational forms. And then when I get back, we'll hit the ground running again.
3 o'clock again?
It'll be, if your time zone is 3 o'clock, yes, 2 p.m. US Central Time. Okay. And I'm still going to be in the, Facebook groups and talking. I have a Facebook group called The Window Pane. You're welcome to join if you'd like. No pressure to join, but you can join there. And in there, I put out facts and information and try to make sure everything is vetted so that we're not getting false or negative things pushed to us too.
We've joined everything you're on.
Oh, well, thank you guys. I'm happy to have you. There's someone in the waiting room, and if you see this in the after, I'm sorry I'm not letting you in because I'm nervous. But yeah, I thank you guys. Oh wait, hold on. Let me make sure there's no questions.
Can I ask a question?
Go ahead.
And I don't know if this is the right time, but
go for it.
When my CRPS started, it was in a limb and it's kind of jumped around. But most recently, it has been in my throat internally. And I just want to know if anyone else, because I can't find a single thing online with anyone else experiencing it.
I have it in my throat.
I thought you mentioned it last week. I wasn't here live, but I watched it on YouTube and I thought I heard you say that. And my eyes welled up with tears when I heard it. And I'm sorry, it's not because I'm glad you have it, but I felt like I had company and not alone.
Well, you're in good company.
Can we connect?
Absolutely.
Okay.
Love it.
Absolutely. My box is open, or I can send you my phone number. I don't know who I'm talking to right now, though.
Rolanda. I don't
All
have
right,
my face on. Yeah.
I'm gonna write it down.
Okay.
So I wanna say something before the whole thing we start to wrap up here. But I wanna draw some correlations for you guys a little bit. And this might be an exercise that you guys can try on your own as well. I've given you a few exercises, but I'm gonna open up paint. Just hearing about this the feeling in your throat. I wanna show you something here. Okay, so can you see paint now?
Yes.
Okay. So I'm going to draw some timelines. Okay, hold on. Okay, so here's a timeline, okay? I'm going to put some events in this timeline. Okay, let me get some text here. This is an exercise I do with a lot of my patients too. So 2008, back pain begins. Okay. 2012, first surgery.
Not your problem.
Second surgery.
No. Good idea.
Okay, I don't know how to fix that, so we'll have to deal with it. And then okay, so here's my first timeline, okay? And I'm sure all of you have a timeline where you can make just like this. Okay, so here's then I want you to make another timeline, a second timeline. And this, you had your physical timeline on the top, and then this is going to be your life event timeline. Okay, significant life events. So I'm going to show you something. So in late 2007, my mom was diagnosed with cancer. In 2011, my mom passed away.
Oh, I feel this with everything that I am right now because this is so relatable.
Okay. Now, the correlation of these things, I personally do not believe is coincidence.
Mm-hmm.
Okay. You can see how these timelines line up. When I get a patient who says something to me like my throat feels tight, there's burning in my throat, or says something to me like I feel this heavy weight on me, or my back hurts, etc. The questions I usually ask are, what is it that you're not saying? Or what is it that you're holding on to that's making these things hurt? Nobody has to answer that in this chat right now. But I want you guys to really think about that, because sometimes that opens up a big picture for you to say, oh man, maybe my physical pain has a lot to do with some other things that I haven't quite looked at yet. And I think that's important. I think that's super, super important. For me, the thing that I hadn't looked at and felt like I hadn't processed, and I didn't even know this or make this correlation until way after I was out of pain and I was in PT school. The thing that I hadn't addressed or allowed myself to feel, I guess is the best way to put it, is a little something called grief.
Yep.
And I hope I spelled that right. But yeah, I think that sometimes emotions show up in ways that maybe we're not expecting. So I want you guys to consider how emotions might play a role in the things and the experiences we have in our body. So yeah, I think that's a good thing to start to wrap up on. But does anyone have any questions or thoughts on that?
Thank you for sharing.
I completely agree with what you said because I can totally relate to it. Not dealing with my sister's suicide or losing my father in 2020 after a terrible hurricane. And yeah, I can totally relate to that.
So all of us, I think, on some level can, and I usually see, some pattern like that with people. Pain is a complex experience. And so look at that correlation and consider how does it play a role in your life and what kind of things can you do on that aspect of things to be 1% better.
Yeah.
Nice. So that's a thought. But I really love the experience that we're having. Oh, and I should share the news that I wanted to share now that we're at the end. This has been a wild experience for me the last 2 weeks. Things have really kind of gotten noticed by people more than I thought, and it's been really emotional and exciting. But have you guys seen Trial by Fire, that first documentary?
No.
Oh, okay. Well, there's a documentary made in 2015 by a celebrity chef and producer whose mom has CRPS. It's called Trial by Fire. It's on Amazon and Apple TV. I remember watching it as I was still recovering from CRPS. But anyways, I was driving to the gym yesterday to exercise, and the producer of that documentary called me, and he wants to come film me at work and get a take on some of the more hopeful side of CRPS and trying to
That's
find
great.
recovery.
Yay.
Yeah. So,
Wow. That's
so
so cool.
thanks, guys. I'm really excited because I think this will
Yeah.
expand our little group we have here and reach some more people that might not even be on the support groups, might be just suffering alone like I was. And so I'm excited
Remember
about
the little
that.
people.
Oh, I'll never forget you guys. You're not the little people. You're the big people. I don't know if you notice in this Zoom, our boxes are all the same size. Okay, so I've really enjoyed this, guys, and I'm going to see you again in a few weeks. I'm going to Japan, so I'll come back with some stories.
This is so exciting.
Enjoy. Thank you.
Yeah.
Yes, thank you.
Thank you guys for joining, and thanks, Amy. I agree. I'm
Bye-bye.
super excited.
Bring it on.
Oh, if you haven't yet, sign up for the email list and check your spam folder so you can get the free alarm document.
Hey Chase, where are you going in Japan?
Tokyo, Kyoto, and Osaka are the plans.
Nice.
I've never been, so we'll see what happens. As a hobby, my 1% activity sometimes is taking pictures, photography.
Me too.
Yeah, perfect. And so that's what I'm going to try to do while I'm there.
You'll enjoy Osaka.
Yeah. Have you been?
Yeah, Osaka and Tokyo I've been to.
Oh, fantastic.
Yeah, you'll love it.
Maybe I'll reach out to you for a few suggestions or pointers.
Yeah, that was a long time ago. It's probably changed a long time since I've been there.
Yeah.
Early
Well,
80s.
Oh, wow. Well,
Yeah.
I'll share some photos, Matt.
There you go. Send them my way.
I will. Well,
You have
thank
a
you
great
guys.
trip.
Thank
Thank
you.
you.
Thank you so much.
Remember your homework.
very
1%
much.
better. Cheryl, go get in that car.
I will do so. I will try.
Okay.
Thank you so much.
Thank
Yeah,
you.
thank you guys.
Thank you.
See you on the
Bye, everyone.
Wednesday 14th.
Bye.
It will be.
you. Thank
I'll
you.
send out thanks, guys. I'll send out
Okay.
a thing, but it's going to be December 21st.
December 21st. Okay, great. Thank you so much.
Awesome.
So we'll have a little break, but you guys got a lot of homework.
Okay, thank you.
All right.
Thank you.
Thanks,
Bye, guys. Thank you.